You're watching Exit 1055 with your host, Richard Rose.
Hey, good morning. I'm Richard Rose. Welcome to Exit 1055 Long Island, your TV 1055 show about all things Long Island. In just a few moments, free air for all at your local gas station. Good for everyone or not. But we begin this morning with a new e-prescription plan. It's meant to crack down on opioid-connected drug abuse. A new system's already in place, and for most of us, it'll mean no more paper prescriptions. TV 1055's Carolyn Gussoff explains.
Gone are the days of walking into a New York pharmacy to drop off a prescription. The old paper script is history. 60,000 doctors, dentists, and others are now required to submit prescriptions electronically.
Overall, it is an excellent change.
After a 4-year phase-in, pharmacist Aaron Kim says e-prescribing reduces errors and is more convenient.
You don't have to make a separate trip to come drop your prescription off, wait, perhaps even come back. This way, the prescription will be waiting for you.
But the motivation behind the system called iStop was the scourge of addiction, authored by Attorney General Eric Schneiderman to stop paper prescription theft and forgeries and stop addicts from shopping for doctors.
By moving to a system of e-prescribing, we're going to curb the incidence of these criminal acts and also reduce errors resulting from misinterpretation of handwriting on good faith prescriptions.
Criminal acts by desperate pain pill addicts, drugstores held up, lives lost. Warren Zeisman runs the largest drug treatment center in Manhattan, ACI Rehab.
Oxycodone has really been the gateway into the heroin scourge here in New York, and so I think it's a tremendous initiative to combat that.
He'd like to see the system go further so that pill addicts, once identified, get help, and doctors required to install sometimes expensive, secure software hope electronic charts will mean more time with patients.
Always paper charts are time-consuming. Now everything in the computer, I know exactly what's the patient diagnosis, what the patient is on with the medication dosages, so there's less room for errors.
Pharmacists say they'll continue to honor paper prescriptions for some time, but doctors who continue to write them could face fines and even jail time. In Albertson, Long Island, Carolyn Gussoff, TV 1055.
And joining us now, Michael Oppenheim. He is the Chief Medical Information Officer at Northwell Health, and welcome to our show.
Good morning. Thank you for having me.
Just started, but how smoothly is the new plan working so far?
Actually, a little better than we expected. We've rolled this out to all of our hospitals, our emergency departments, and things seem to be going pretty well.
You heard the Attorney General there talking about hopefully it'll cut down on wrongly prescribed or bad handwriting type prescriptions. Supposedly the error rate is going to be less with this. And you even brought an example for us that we took a photo of here, and you maybe could hold it up as well. This is a doctor's handwriting, right? Show it to this camera here in the middle, and there you go. And I have no idea what that says.
So this is obviously, on the surface, completely illegible. In fact, when most clinicians look at this, they can actually make out what looks like Coumadin, which is a very commonly prescribed blood thinner. In fact, the intended prescription was something called Avandia.
Wow.
Avandia is a diabetes medication.
Wow, that's dangerous to get those two mixed up now, because blood thinner can be very dangerous.
Absolutely. A blood thinner for someone who doesn't need it is certainly dangerous, and the person wouldn't be getting their diabetes medicine.
Do you think this turns medical professionals into the police, though? Because you got to check the eScript database, and now you got to make sure that there's nobody messing with your prescriptions.
I think prescribers generally want to do the right thing. The iStop legislation, as you know, went into effect in 2012. Excuse me. And even before the electronic prescribing mandate, prescribers have had to go to the state website and confirm that the patient for whom they're prescribing opiates hasn't received it from multiple other providers.
Have you seen maybe a change in the behavior of some of the people prescribing, in particular the painkillers that everybody's worried about?
I think in the emergency room setting, it's actually been quite helpful, because that's probably where we see most of the drug-seeking behaviors coming in. I'm not sure that in private practices it's made a tremendous amount of difference.
Yeah, because they try to doctor shop, and they also try to go to places where maybe there's a lot of people. A lot of the prescriptions were stolen out of the New York City hospital system, and you know, they try to take advantage of the fact that there may be chaos in these kind of emergency room situations, and people making those kind of mistakes. Yeah, because I hear from doctors that they're already looking for alternatives, or they're prescribing a smaller amount.
Well, certainly the work that it takes to prescribe has gone up significantly, both because of the iStop legislation, as well as what it takes to electronically prescribe. In addition to just entering the script, as you can for non-controlled substances, you have to go to your device or some other way that you use an electronic token that has this constantly changing number, put it into the system. It definitely adds to the work burden and will certainly cause people to think twice.
And that's for the people on the medical side of it. What happens to the folks who are on the receiving side? Because it's a different world for them as well. How do they get their prescription now? They just go to the pharmacy and it's there?
So it's been an interesting mixed blessing. So on the one hand, there's a convenience factor. Remember, this legislation is not only for the controlled substances. Every medication has to be prescribed electronically. And in our physician offices at Northwell, we've been doing that for non-controlled substances for years. That's a big convenience for the patients who don't have to come to the pharmacy, hand the paper script, and then wait while it gets filled. We even did an interesting promotional video where we filmed a number of folks on our IT staff in a pharmacy acting like frustrated folks waiting for their prescriptions, and then our patient walks to the front. So that's been the upside. There are some unintended potential downsides with this. Suppose a patient's discharged late. They give the name of their pharmacy. They get to the pharmacy and it turns out their pharmacy's closed, but the one down the street is open. They don't have the paper prescription in hand to just walk to the other pharmacy. What we've also observed, which was a surprise to us, is that many pharmacies that have licenses to prescribe controlled substances have decided not to stock those medications. So now a patient arrives and they can't get their medication, and the pharmacy can't transfer that to another pharmacy.
Yeah, that could be a problem. Have you seen doctors dropping out? There was concern that maybe a lot of them wouldn't want to deal with this because there's a considerable expense involved.
There is. I think it's a little too soon to tell. I anticipate that we might see things as what happened with when the malpractice premiums for obstetrics went very high, where practices would designate certain people within the practice to continue doing just the obstetric component, which has the high malpractice, and they've stuck to something like GWN. I think we may see some shifting within larger practices. For what's going to happen for the smaller practice, we'll see.
Well, and the exemptions, of course, to get another year are nursing facilities because they don't always have a doctor on staff, and they're still coordinating their facilities, and also people who prescribe compounded prescriptions that are complicated, so those don't easily fit into the system. But if we have this opioid crisis where people are dying every day, why give any more extension? We've already had a one-year extension.
I think you have to weigh the risks of prescribing with an electronic solution that's not really appropriate for what you're trying to prescribe, like a compounded medication, with the risks of opiate abuse. And especially when you're thinking about folks in residential facilities like nursing homes, the risk of opiate abuse in that circumstance is a lot smaller, while the risk of the patient not getting their medication is significant.
Yeah, let's hope we don't come across any stories like that, and none of that happens. But Michael Oppenheim with Northwell Health, thanks for coming in and explaining the paperless road that's ahead for all of us in terms of getting our prescriptions.
Thank you.
You bet.